Medications save lives and often play a vital role in managing people's health, especially as we age. But they can be a double-edged sword when their side effects can cause problems like a heightened fall risk. Joining us now is pharmacist Angie Woodmansey, who will talk with us about how to better understand medications and to help make sure they don't cause falls. It's great having you here today. Thanks for being here.
Thank you, Beth. I'm happy to be here.
Let's start talking about some of the medications that can cause falls. Are there different types that people should be aware of, especially older adults?
Definitely. There are certain categories of drugs that have a heightened fall risk. And what I always advise patients as a pharmacist is to always look at your prescription drug bottles. On them, you'll see these colorful stickers, and those are warning labels. If they see anything that says may cause drowsiness, may cause dizziness, may impair your ability to drive, those are big red flags that those medications could increase your risk for falling. And then if you don't mind, I thought I would just kind of go through different categories of medications to kind of give a little bit of tidbits about each of them. The first big category would be sedatives. These are sleep agents. They can be prescriptions such as Zolpidem or Ambien, or even over-the-counter products that contain diphenhydramine or Benadryl. These medications are designed to make you sleepy, which is great if you're using it for insomnia, but if you have to get up in the middle of the night to go to the bathroom, that can put you at a great risk for falling. And also, they're really designed for short-term use. So if you're finding that you're having to take a sedative every single night, it's really important to talk to your doctor about that, to maybe talk about non-medicine ways to help you fall asleep at night. And then the second category of drugs I'd like to talk about are anti-anxiety medications, particularly benzodiazepines. These are drugs such as diazepam or alprazolam, and these are also kind of designed for short-term use for really acute anxiety, and they can make you very drowsy to calm you. But if you're taking those every single day to manage your anxiety, those can also increase your risk for falling and for side effects. And so talk to your doctor, because there are other categories of anti-anxiety medications with a much lower fall risk.
Okay.
And then I'll talk about the next three categories. I want to kind of group them together, and those are antidepressants, antipsychotics, and anti-seizure medications. They all work on your brain, but unfortunately they can cause side effects of drowsiness, which can increase your fall risk. And so if you're on one of those medications and you feel a lot of drowsiness, talk to your doctor, because within each of those categories there's a spectrum of drugs. Some of them can cause more sedation and some of them can be more energizing. So talk to your doctor about finding the right one for you. And then the next category of drugs are the opioid pain medications. This is kind of a hot topic as they're very heavily prescribed. And these medications, of course, they contain hydrocodone or oxycodone or morphine, and all of them can increase your risk for drowsiness. And so you would want to use caution and be careful about chronic use of these medications as well. Talk to your doctor about maybe trying a non-opioid pain reliever if you can. And then muscle relaxants, such as cyclobenzaprine or Flexeril, are designed to relax your muscles, but because of that, that can increase your risk for being unsteady and for falling. So use caution with those. And also, surprisingly, overactive bladder medications have a side effect of drowsiness and dizziness, so something to be aware of. And even allergy medications, as we're approaching allergy season, that can also have an impact, because if you're taking an older antihistamine such as Benadryl or diphenhydramine, that can cause a lot of sedation. And so you would want to consider using one of the newer antihistamines if you could, such as Claritin or Allegra, as they're not as sedating. And then my next category are the blood pressure medications. These medications can greatly lower your blood pressure, which you want to happen, but if you're going from lying down to sitting to standing up very quickly, you can get a great drop in your blood pressure unexpectedly. And so I always advise patients on blood pressure pills to take their time getting out of bed and ease into that transition of standing up. And then our very last category are diabetes medications. These are designed to lower your blood sugar, but sometimes it can lower it too much and can cause symptoms of hypoglycemia, which can make you feel dizzy, drowsy, confused. So as a diabetic, you would want to be aware of those side effects and always have handy a source of sugar, such as juice or raisins or crackers. But that basically sums up the major categories of drugs to be aware of.
And there are several, and they are ones that help people manage their health on often a day-to-day basis, so they can't necessarily just stop taking these medications. So what should they do in situation? Do they talk to their doctor or a pharmacist, both?
Oh, that's a great question. They definitely would want to talk to their doctor before stopping any medication. And that's really important because sometimes you need to wean off of medications. And also sometimes they may just want to lower the dose of your current medication or switch you to an alternative medication. And really only a doctor can do that. But pharmacists are also a great resource. We're readily accessible. You can walk up to any pharmacy counter and talk to a pharmacist. And we are medication experts, so we are trained to help advise you about drug interactions or side effects. So really it's a partnership.
Great. And what about vitamins and supplements, Angie? Can those help prevent falls? Are they helpful to take?
Yes, there's been a lot of research about vitamin D, especially 800 to 1,000 international units a day, in helping seniors decrease the risk for falling. It can improve their bone, muscle, and nerve health, and so there's a lot of data on that. But do talk to a doctor before starting any supplement, just in case there's a reason you shouldn't be on it.
Okay, good. And what about then, we've talked on the show before about the importance of kind of sticking to one pharmacy or one pharmacist when you're filling your prescriptions. Is that important to do too when it comes to fall prevention?
Absolutely, because as a pharmacist, we can only see the medications that are being filled at that pharmacy that we work at. And so we don't know what you're filling across the street at another pharmacy. And so to really allow us to get a full drug interaction screen, we really need to know all the medications you're on. And so if you aren't filling, if you're doing some mail orders, some at your local pharmacy, you want to let your pharmacist know what you're getting elsewhere.
Okay, perfect. Thanks so much, Angie. Great
you're
information.
Welcome. Great.
So we've talked about your body and your health. We've talked about your medications. Up next, what fall risks are in your home and around town? Stay with us. We'll talk more about fall prevention after these messages.